India has the world's fourth highest number of confirmed cases, more than 400,000 infections and over 13,000 deaths. But some frontline healthcare workers have told the BBC that the number of fatalities in the country has been underreported. Our correspondent in Mumbai, Yogita Limai, reports.
They're always on the go now. For decades, Jitendra Singh Shanti has been carrying the dead from hospitals to crematoriums in Delhi. But as India battles the coronavirus pandemic, he says they're witnessing an unprecedented situation. I've not seen such a scary period in my life. We used to transport about 5 bodies a day for cremation, but now that's increased to 25. The situation in Delhi is really bad, he says. From the country's graveyards, crematoriums and hospitals, there are accounts that the real number of people who've died of coronavirus is higher than official data. Frontline doctors from different parts of India have told the BBC there are many who are not being counted. They didn't want to be identified, fearing reprisal from the government.
There is a massive underreporting in Delhi. In our isolation ward, 45 people have died in the past 3 weeks, out of which only 7 were tested. We don't know if they had COVID or not, but they definitely showed the symptoms.
The deaths are happening because of coronavirus, but they show the patients died of comorbidities like hypertension or diabetes.
And there are other examples. On the left is the positive test result of a man who died in Mumbai. On the right, the hospital's death certificate, which makes no mention of Covid-19. The hospital certificate says he died of respiratory failure, says his son, who didn't want to be named. They're not alone. This week, Mumbai and Delhi have added hundreds of previously unreported deaths to their data. But even so, it's mainly those who die in hospitals who are counted in official COVID numbers.
In India, more than half of all deaths in urban areas don't take place in hospitals. They occur at home. In rural parts, that proportion is even higher. Many of these deaths are recorded with local authorities, but even during normal times, there are long delays, which are likely to be worse in the midst of a pandemic.
There's 2 ways to look at it.
I asked an expert who studied the reporting of deaths in India what he thought of the official numbers.
How many deaths are occurring in India is probably vastly underestimated. So if you look, for example, at the Million Death Study results on how many pneumonia deaths in adults occurred, if we just relied on the records from the urban reporting areas, there was about a 3- to 4-fold underestimation. And we think that for COVID, it's at least that.
In a vast country with many layers of government, the true scale of the toll that coronavirus is taking in India might never be known. Yogita Limai, BBC News, Mumbai.